Have you ever received test results that showed everything was normal, only to find out months later that something serious was hiding beneath the surface? That crushing feeling when you realize precious time was lost because a test failed to catch what was really happening. If you or someone you love is over 65, this information could literally save a life. I've seen it happen too many times in my practice. Just last month, Eleanor, a vibrant 72-year-old grandmother of 5, came to me after 6 months of being told her symptoms were just normal aging. Her previous doctor ran what seemed like all the right tests, but they all missed the stage 3 cancer that had been growing inside her all along. What her doctors didn't tell Eleanor is that some of the most common tests we rely on can be dangerously misleading for seniors. Today, I'm going to reveal the 5 tests that most frequently give false reassurance to older adults and the deadly cancers they often miss. I'll also share exactly what you should ask for instead. This information isn't widely discussed, but it could mean the difference between catching cancer when it's still treatable and discovering it when it's too late. So please, stay with me until the end, because the test that's most likely to mislead you might surprise you. Hey there, it's great to have you watching today. Before we dive deeper, I'd love to know where you're watching from. Drop your location in the comments section below, and if you have any questions about cancer screening for seniors, don't hold back, I'm here to help. Also, if you're new here, make sure to hit that subscribe button and turn on notifications. I share vital information about cancer care for older adults every week, and I don't want you to miss any updates that could help you or your loved ones navigate this challenging journey. I need to take a moment here and ask you something important. How has cancer screening affected your life or the life of someone you care about? Has a test ever missed something significant, or has an early detection saved a life? You know, many people feel completely blindsided when a cancer diagnosis comes after they were told everything looked fine on their tests. That feeling of betrayal and confusion can be overwhelming, like the ground suddenly disappeared beneath your feet. I understand how exhausting it can be to advocate for proper testing when doctors keep dismissing concerns as just getting older. This is your space to share what you've been through without judgment. You can simply copy, "My experience with cancer testing has been," and share as much or as little as feels right for you. Your story might be exactly what someone else needs to read today to push for the right tests or seek a second opinion. Every comment helps build our community of support and reminds others they're not alone in this fight. Plus, your experiences help me create more relevant content that addresses the real challenges you are facing. The sad reality is that many seniors receive false reassurance from common medical tests, leading to delayed cancer diagnoses and potentially fatal outcomes. This happens because as we age, our bodies change in ways that can mask cancer's warning signs or cause tests to be interpreted differently. Let's dive into these 5 deceptive tests and understand why they frequently fail our older population. The first test that commonly misleads seniors is the basic complete blood count, or CBC. This simple blood test is often the first line of screening during regular checkups, but it can be dangerously unreliable for detecting cancer in older adults. Many doctors will look at a CBC, and if the numbers fall within the normal range, they'll move on without further investigation. What they're not telling you is that these normal ranges were primarily established based on younger adults. As we age, our baseline blood values naturally shift, meaning what's abnormal for a 40-year-old might actually be a serious red flag for someone who's 75. For example, a slightly low red blood cell count might be dismissed as age-related anemia when it could actually be signaling a bleeding tumor in the colon or stomach. Studies from the National Cancer Institute show that up to 40% of seniors with early-stage colorectal cancer had CBC results that were technically within normal limits. This false reassurance often leads to critical delays in diagnosis. The mechanism behind this misleading result is fascinating but troubling. Cancer often develops slowly in older adults, giving the body time to compensate and maintain near-normal blood counts despite significant disease progression. Additionally, older bodies often have reduced bone marrow reserve, meaning they simply produce fewer blood cells overall, masking the drops that would be obvious red flags in younger patients. A 2022 study published in the Journal of Geriatric Oncology found that relying solely on CBC screening missed nearly 35% of blood and lymphatic cancers in patients over 70. Have you or a loved one ever had a normal blood test despite persistent symptoms? That's exactly the situation we're talking about. The real danger comes when both patients and doctors place too much confidence in these tests. I remember working with Robert, an 82-year-old retired teacher who had been gradually losing weight and feeling increasingly fatigued. His primary care physician ran a CBC that showed values at the lower end of normal. Rather than investigating further, Robert was told he was just experiencing normal aging. 6 months later, when he finally came to me for a second opinion, we discovered advanced pancreatic cancer that had been slowly developing all along. His CBC had never triggered alarm bells because his body had been compensating remarkably well, but other tests would have caught it immediately. The proper approach with CBC results in seniors is to look for trends rather than absolute values. Even slight changes within the normal range can be significant. If you're over 65, you should ask your doctor for copies of all your CBC results and keep track of them yourself. Look for any consistent changes, even small ones, and bring them to your doctor's attention. More importantly, if you have symptoms that concern you, never let a normal CBC be the final word. Insist on age-appropriate cancer screening tests, regardless of what the basic blood work shows. For those with persistent fatigue, unexplained weight loss, or vague abdominal discomfort, request specific tests for inflammatory markers like C-reactive protein or tumor markers appropriate for your risk factors. These additional layers of testing can catch what a basic CBC might miss. The second misleading test is the basic chest X-ray, which is frequently used as a first-line screening tool when seniors report respiratory symptoms. The problem: standard chest X-rays miss approximately 25% of lung cancers, with even higher miss rates in older patients. This is particularly alarming considering that lung cancer remains the leading cause of cancer death in America, with a disproportionate impact on those over 65. The limitations of chest X-rays in detecting early-stage lung cancer are well documented but not widely communicated to patients. Early-stage lung tumors are often small and can be hidden behind the heart, beneath the diaphragm, or within dense lung tissue that naturally occurs with aging. Additionally, elderly patients often have other lung conditions like chronic obstructive pulmonary disease, COPD, or pulmonary fibrosis that can easily mask cancerous lesions on a basic X-ray. The statistics here are sobering. According to research published in the New England Journal of Medicine, nearly 40% of lung cancers in patients over 70 that were eventually diagnosed at stage 3 or 4 had been present but invisible on chest X-rays taken 6 to 12 months earlier. That's almost half of cases where patients were told everything looks fine when cancer was actively growing. I've seen this heartbreaking scenario play out countless times in my practice. There was Doris, a 78-year-old who had a persistent cough for months. Her primary care doctor ordered a chest X-ray that showed age-appropriate changes but nothing concerning. It wasn't until almost a year later, when she developed chest pain, that a CT scan revealed a significant lung tumor that had already spread to her lymph nodes. The X-ray had missed it completely, giving both Doris and her doctor false reassurance that delayed potentially life-saving treatment. The practical implications here are clear. If you're over 65 and have any risk factors for lung cancer, smoking history, family history, exposure to radon or asbestos, or simply persistent respiratory symptoms, a chest X-ray is not sufficient screening. You should request a low-dose CT scan instead, which is far more sensitive at detecting early-stage lung cancers. A landmark study showed that screening with low-dose CT scans reduced lung cancer mortality by 20% compared to chest X-rays. If your doctor hesitates to order a more comprehensive scan, remind them that Medicare now covers annual low-dose CT screening for lung cancer in high-risk individuals. Don't let concerns about radiation exposure prevent proper screening either. Modern CT scanners use much lower radiation doses than in the past, and the benefit of early detection far outweighs the minimal risk from the scan itself. Remember that symptoms like a persistent cough, chest pain, shortness of breath, or coughing up even small amounts of blood should never be attributed to just getting older without proper investigation, regardless of what a chest X-ray shows. The third test that frequently fails seniors is the standard PSA, prostate-specific antigen blood test, used to screen for prostate cancer. Now, this one is particularly tricky because the problem isn't that the PSA misses cancer. It's that the standard interpretation of PSA results in elderly men can lead both to missed cancers and unnecessary treatments. Here's why this gets complicated for seniors. PSA levels naturally rise with age, even in the absence of cancer. This means that using the same cutoff value, typically 4.0 ng/ml for all men, regardless of age, can be deeply flawed. For some older men with aggressive prostate cancer, their PSA might rise from 0.8 to 2.5, a significant jump that still falls within the normal range and would typically not trigger further investigation. The medical community has been debating PSA screening in older adults for years, with some guidelines even suggesting stopping PSA screening altogether after age 70. But this one-size-fits-all approach can be dangerous for many seniors. The clinical research tells a more nuanced story. A study in the Journal of Clinical Oncology found that it's not the absolute PSA value that matters most in older men, but the rate of change over time, what doctors call PSA velocity. An increase of more than 0.75 ng/ml per year, even within the normal range, can be a warning sign of aggressive cancer that needs immediate attention. Let me share a case that illustrates this perfectly. George, a healthy and active 75-year-old, had been getting regular PSA tests that consistently showed levels around 3.0, technically normal. His doctor, following standard protocols, saw no reason for concern. But when George came to me for a second opinion, I noticed something his previous doctor had missed. His PSA had increased from 2.1 to 3.0 in just 18 months. While still normal, this velocity was concerning. Further testing revealed an aggressive prostate cancer that, had it been left undetected based on the normal PSA reading, would have likely spread beyond the prostate within a year. The practical takeaway here is clear. If you're a man over 65 who has chosen to continue PSA screening, you must track not just whether your PSA is normal or elevated, but how it changes over time. Request copies of all your PSA results and plot them yourself if necessary. A rapid rise, even within normal limits, warrants further investigation. Additionally, there are now better ways to evaluate prostate cancer risk beyond the basic PSA. If you have any elevation or concerning change in PSA, ask your doctor about additional tests like the 4K score, PSA density, or the newer urine-based tests that can help distinguish between aggressive cancers that need treatment and indolent ones that can be safely monitored. It's also worth mentioning that PSA interpretation becomes even more complicated if you're taking certain medications common among seniors, like finasteride or dutasteride for enlarged prostate. These drugs artificially lower PSA readings, so results need to be adjusted accordingly, something that doesn't always happen in busy primary care practices. The stakes of getting this wrong are high in both directions. Missing an aggressive prostate cancer can be fatal, but unnecessary treatment of a non-threatening cancer can lead to serious side effects like incontinence and impotence that significantly impact quality of life for seniors. The fourth misleading test affects women specifically, the standard mammogram. While mammograms remain an essential screening tool for breast cancer, they become significantly less reliable in older women for reasons that aren't widely discussed. As women age, their breast tissue typically becomes less dense and more fatty, which should theoretically make mammograms more accurate. However, several age-related factors actually reduce mammogram reliability in seniors. First, the standard two-view mammogram, taking images from just two angles, may miss cancers in women with significant breast drooping, which naturally occurs with age. Second, certain types of breast cancer that are more common in older women, like invasive lobular carcinoma, often don't form distinct lumps and can be nearly invisible on standard mammography. The statistics are concerning. Studies show that mammograms may miss up to 15% of breast cancers in women over 70, compared to about 10% in younger women. This difference might seem small, but it represents thousands of missed diagnoses annually. Additionally, there's often a dangerous assumption that breast cancer grows more slowly in elderly women, leading to less aggressive follow-up of suspicious findings. While some breast cancers in seniors are indeed slow-growing, others can be highly aggressive and quick to metastasize. Barbara's story illustrates this problem perfectly. At 81, her annual mammogram showed a small area of concern that was categorized as probably benign, with a recommendation for follow-up in 6 months rather than immediate biopsy. Because of her age, both Barbara and her doctor assumed there was little urgency. When she finally had the biopsy 6 months later, it revealed an aggressive triple-negative breast cancer that had already spread to nearby lymph nodes, a subtype that typically grows rapidly, even in older women. The 6-month delay significantly worsened her prognosis. What should older women do to protect themselves from this mammogram blind spot? First, know that 3D mammography, tomosynthesis, is significantly more accurate than standard 2D mammography for women of all ages, but especially for seniors. If you're over 65, insist on 3D mammography if it's available. Second, if you have any breast symptoms, a lump, skin changes, nipple discharge, or breast pain, never let a negative mammogram be the final word. Request additional imaging, like breast ultrasound or MRI. Third, be aware of your personal risk factors. If you have dense breasts, yes, some women maintain breast density even in their 70s and 80s, a family history of breast cancer, or previous atypical findings on biopsies, standard screening recommendations may not be sufficient for you. And finally, understand that mammogram interpretation is somewhat subjective. If you have ongoing concerns despite a negative mammogram, seeking a second opinion from a different radiology group is entirely reasonable. The mammogram limitations for seniors extend beyond just the imaging itself. Many screening facilities aren't adequately equipped for older patients with mobility issues, which can result in poor quality images. Additionally, comparisons with prior mammograms are crucial for accurate interpretation, but older records are often unavailable when women change doctors or move to new care facilities, a common occurrence in later life. If you've had mammograms at different facilities over the years, make a concerted effort to gather all prior images and ensure your current radiology team has access to them. The fifth and final test that commonly fails seniors is perhaps the most surprising, the standard colonoscopy. Now, colonoscopy is generally considered the gold standard for colorectal cancer screening. But for elderly patients, several factors can make this test less reliable than most people realize. First, there's the preparation problem. The harsh bowel prep required before a colonoscopy can be particularly difficult for seniors to complete properly. Dehydration risks, medication interactions, and physical stamina challenges often lead to incomplete preparation. An inadequately cleansed colon significantly reduces the effectiveness of the exam, potentially allowing cancerous lesions to hide behind residual material. Studies show that up to 30% of seniors have inadequate bowel preparation compared to about 15% of younger adults. Second, there's the anatomical challenge. As we age, the colon often becomes more tortuous, twisted, and has more diverticular pouches, making it both technically harder to examine completely and easier for small cancerous lesions to hide. Research published in the journal Gastrointestinal Endoscopy found that the cecal intubation rate, the percentage of colonoscopies that successfully reach the beginning of the colon, is significantly lower in patients over 75, meaning parts of the colon simply aren't being examined. Finally, there's growing evidence that certain fast-growing cancer types, particularly those arising from serrated polyps, can develop in the interval between colonoscopies, even when the previous exam was negative and performed correctly. These interval cancers appear to be more common in older adults. The real-world impact of these limitations was evident in Thomas's case. At 79, he had a screening colonoscopy that was reported as normal, though the report noted fair preparation quality. When he developed subtle symptoms just 2 years later, his doctor initially attributed them to irritable bowel syndrome, citing the recent clean colonoscopy as reassurance against cancer. By the time another colonoscopy was performed, a significant tumor was found in the ascending colon, a section that can be particularly challenging to visualize thoroughly in elderly patients. The key message here is not that seniors should avoid colonoscopy. It remains a vital screening tool. Rather, older adults and their doctors need to understand its limitations and take steps to mitigate them. If you're over 65, insist on a senior-friendly bowel preparation regimen that's easier to tolerate. Some gastroenterologists now offer modified preps specifically for elderly patients that are gentler yet effective. Ask about the quality of your preparation after the procedure. If it was less than optimal, discuss with your doctor whether a repeat examination is warranted sooner than the standard interval. Be aware that the skill and experience of the endoscopist matter tremendously. Research shows that adenoma detection rates, the percentage of colonoscopies in which the doctor finds at least one precancerous polyp, vary widely among physicians. When scheduling a colonoscopy, it's entirely appropriate to ask about the doctor's adenoma detection rate. It should be at least 25% for a mixed-gender practice. Additionally, for seniors who have had a negative colonoscopy but develop even subtle symptoms like changes in bowel habits, unexplained weight loss, or rectal bleeding, even if attributed to hemorrhoids, don't let that previous normal result prevent timely investigation. Consider complementary screening methods like the FIT, fecal immunochemical test, or stool DNA tests between colonoscopies. While these tests have their own limitations, they provide an additional layer of surveillance that might catch what colonoscopy missed. It's worth noting that some newer technologies, like AI-assisted colonoscopy and specialized imaging techniques such as narrowband imaging, show promise for improving detection rates in challenging cases, including those involving elderly patients with difficult anatomy. Now that we've covered these 5 potentially misleading tests, I want to emphasize something important. The problem isn't usually with the tests themselves, but with how they're applied and interpreted in older adults. Age-related changes require different approaches to screening and diagnosis, but our healthcare system often fails to adapt. Beyond the specific tests we've discussed, there are broader strategies seniors can use to protect themselves from delayed cancer diagnoses. Trust your symptoms over test results. If you're experiencing persistent changes in your health, unexplained weight loss, new pain, unusual fatigue, changes in bowel or bladder habits, don't let normal test results dismiss your concerns. Our bodies are remarkably good at telling us when something is wrong, and this intuition becomes even more valuable with age and experience. Seek age-appropriate expertise. Not all healthcare providers have specialized knowledge in geriatric medicine or oncology. When possible, work with doctors who have specific experience with cancer in older adults, as they're more likely to understand the nuances we've discussed today. Keep detailed health records. Tracking symptoms, test results, and even subtle changes in your well-being over time can reveal patterns that might otherwise be missed in the brief snapshots provided by occasional doctor visits. This longitudinal perspective is particularly valuable for seniors, as cancer often develops gradually with subtle initial signs. Consider getting a second opinion. This is especially important if you have persistent symptoms despite reassuring test results, or if you fall into any high-risk categories for specific cancers. Different doctors bring different perspectives and experiences, and sometimes a fresh set of eyes can spot what others have missed. Advocate for comprehensive screening. Rather than relying on single tests, ask about multimodal approaches that combine different screening methods to increase detection accuracy. For example, combining mammography with breast ultrasound, or using blood-based biomarker tests alongside imaging studies. Be aware of age bias in healthcare. Unfortunately, ageism can affect medical care, with symptoms sometimes being too quickly attributed to normal aging, rather than investigated thoroughly. Don't hesitate to politely but firmly push back against this mindset if you feel it's affecting your care. Let's take a moment to recap what we've covered today. We've discussed 5 commonly used tests that can mislead seniors and delay critical cancer. Diagnoses: the basic complete blood count, which may show normal results despite underlying cancer due to age-related changes in baseline values. Standard chest X-rays, which miss a significant percentage of lung cancers in elderly patients. PSA testing, where age-adjusted interpretation is crucial but often overlooked. Mammograms, which become less reliable in older women due to breast tissue changes and technical challenges. And colonoscopies, which face unique obstacles in seniors related to preparation quality and anatomical changes. The common thread connecting all these issues is that standard testing approaches often fail to account for the physiological changes that come with aging. That doesn't mean these tests are worthless for seniors, far from it. Rather, they need to be applied with age-appropriate modifications and interpreted with an understanding of their specific limitations in older adults. Thank you so much for staying with me throughout this important discussion. If you found this information valuable, please hit that like button and leave a comment sharing your thoughts or experiences. Your engagement helps this vital information reach more people who might benefit from it. And if you haven't already, please subscribe to our channel and turn on notifications so you don't miss our upcoming videos on cancer care for older adults. Remember, knowledge truly is power when it comes to cancer detection. By understanding the limitations of standard testing and knowing when to ask for more, you're taking a crucial step toward protecting yourself or your loved ones from delayed diagnoses. You deserve healthcare that recognizes and addresses your unique needs at every age. Stay informed, stay vigilant, and never stop advocating for the comprehensive care you deserve. Until next time, wishing you and your loved ones the very best of health,